So welcome everyone to the Apprenticeship Illinois webinar Lunch and Learn series. Today's session title is Yearly Checkup, Reflections and Advice from Illinois' Healthcare Apprenticeships. So as a reminder, uh, today's session is kind of the last in this session. Nate, I believe, has a calendar of events set to go out soon for 2025 for future events. So you should have already gotten that or being seeing that shortly for the registration links for upcoming events as well. Um, Also, so to introduce our two speakers today, we have Cami Vale. She's an esteemed clinical nurse educator at Clay County Hospital. She brings a wealth of knowledge and experience to her role. A graduate of McMurray College, she earned her Bachelor of Science in Nursing in '07 and has dedicated 17 years to the nursing profession. For the last 7 years, she's been an integral part of Clay County Hospital, where she oversees all employee education, ensuring staff members are equipped with the latest healthcare practices and knowledge. In addition to her primary responsibilities, she also plays a vital role in local community by teaching health occupations at the Clay County High Schools, nurturing the next generation of healthcare professionals. Her expertise extends to diabetes education department, where she assists in data collection and quality improvement, and also serves as a wound care consulting nurse, providing specialized care and guidance in the treatment of complex wounds. Moreover, she oversees the nursing apprenticeship program at the hospital, offering a supportive learning environment for aspiring nurses to gain hands-on experience under her expert mentorship. Her dedication to education and patient care highlights her commitment to advancing healthcare standards and improving patient outcomes. Our other presenter is Alani Frederick. She serves as the Dean of Health Professions for Illinois Eastern Community Colleges, overseeing the education of over 150 nursing students annually, along with several other allied health programs. She earned her doctorate in nursing from Northern Kentucky University and holds certifications in progressive care nursing and nursing education. Having experience both hospital education and academia, Dr. Frederick has been a dedicated leader at IECC for the last 3 years and continues to practice as an ER nurse and believes that contributing to the growth of future healthcare professionals is both an honor and a privilege. With that, I'll hand it off to Nate.
Yeah, good morning or good afternoon, everybody. Thanks as always for attending one of our Lunch and Learn webinars. As Jordan mentioned, this is the last of our inaugural series of Lunch and Learn webinars, but there will be more to come very soon, so stay tuned for that. I always like to do at the top a brief reminder about the services provided by our Apprenticeship Illinois specialists. Our regional specialists are spread throughout the state. You can find yours at apprenticeshipillinois.com. They are there to be a one-stop shop for apprenticeship development and registration with the Department of Labor. They conduct in-person and virtual outreach through events and employer consultations, one-on-one, virtual, in-person, whatever the needs may be. They receive and pursue the referrals received to the apprenticeshipillinois.com. What a great website. Employer form, and they work with employers to fully develop and register their programs from start to finish. A one-stop shop. They have the migraine, so the employers do not have to, we always say. And they connect employers to other valuable intermediary partners and other applicable services. So if you work with employers who are interested in knowing more about registered apprenticeship or developing and registering their own, please visit apprenticeshipillinois.com and find the specialist for your area and make a referral today. We all can do our part to help create opportunities for long-lasting, successful careers in the state of Illinois. And with that, I think we will hand it off to our presenters.
Hey, hi everyone, welcome. My name is Dr. Frederick and I'm the Dean of Health Professions at IECC. So of course, being the academic side of our partnership, I would love to start with some learning objectives for you all. So today we're going to be explaining the rationale, the planning, and the collaboration that kind of started this whole journey towards the RN apprenticeship program. We're going to talk about how it's structured and how we launched it. And then of course, we'll talk about the current status and sort of the impact that we're starting to see both in the hospital side and then in the academic side. So we want to start with just giving you some general information about how nursing apprenticeships are kind of set up around the country. So you are here, so you obviously probably know some of the basics about apprenticeships, but you may not know how nursing apprenticeships are set up. There's two main schools of thought or styles, if you will, of nursing apprenticeship programs. If you've gone to educational conferences, NLN, OADN, any of these sort of places where they're starting to really highlight and lean into registered nurse apprenticeship programs. So I nicknamed these the Alabama model and the Indiana model. These may not be the official terms, but these are the two most famous states for their type of models. So the first is the Alabama model, which is the most famous apprenticeship model, I think, of all of the states that currently have some. This is where it is led by the academic partner. So the academic partner, the college, the university, is really the leader of the program. They're the ones that oversee the competency sheets. They're the ones that oversee how the program looks and structured. This is going to kind of come into play when we talk about the approval process, because the approval process, as far as on an academic side, for an academic-led partnership, includes State Board of Nurse approval, includes going through your third-party accreditor, whether it's CCNE, whether that's ACEN. But the model that we use is an industry-led partnership. This I became familiar with working in academia in Indiana. Indiana is a state that has really embraced and started to go forward with the industry-led partnership, where us as an academic institution, and we'll go into this a little bit further, where we support and we graduate the students, but we do not alter any part of their educational experience. And the managing of the apprenticeship with the preceptors and the on-site learning and the competency forms, all of that happens with the industry partner. So we are an industry-led, it's the Clay County Hospital apprenticeship in partnership with IECC, as opposed to some of you all may be more familiar with the Alabama model, which is the college leads the apprenticeship and then finds partnerships to send their students towards.
Hi, everybody. I'm Kami Vale. I'm the clinical nurse educator at Clay County Hospital. So I'm just going to start off by telling you a little bit about the hospital. We're a 20-bed critical access hospital here in Flora, Illinois. For some of you who may or may not know where that is, we're kind of in south central eastern Illinois in the middle of a cornfield. We are kind of one of the major areas for healthcare here in our county, of course, being mainly rural. We have a lot of different services here at our facility. We have inpatient services, outpatient services. We operate 3 medical clinics, one of those being a major behavioral health clinic. And we have an on-site retail pharmacy, which we just added to the campus within the last year, which has been great for just focusing on accessing healthcare for our patients and trying to eliminate those barriers. Our mission is that we're committed to providing the highest quality of patient-centered healthcare to our community, and that is really what we focus on. So we had to come up with a way in the nursing shortage to get more nurses, and so we've really focused on the growing our own. That's kind of been our motto. It's driven not only this program, but our Health Doc program that we do with the Clay County schools, and they kind of build off each other. But we found if we can't find them, we'll grow them. So that's kind of what we're doing with this.
So I'll share a little bit about our college. So IECC is one of the 2 multi-college districts in the state of Illinois. We are also located in southeastern central rural Illinois. We have over 3,000 square miles that we serve, and we serve all or part of 12 different counties. So we have 4 colleges that are part of our district. We have Olney Central in Olney, Illinois, Wabash Valley, which is in Mount Carmel, which is not too far from the Evansville area. We have Lincoln Trail College in Robinson, which is not too far from the Terre Haute area. And then we have Frontier Community College in Fairfield, which is right off of Interstate 64. So these 4 colleges have been serving this area really since the 50s and the 60s. And the nursing program began began in 1969. It expanded and we run it at all 4 of our campuses. We are ACEN accredited and we do award an AAS for 72 credit hours. We're an integrated curriculum, so some of you all may be familiar with the 4 10-hour credit courses. So we do not have, let's say, a standalone pharmacology course or a standalone geriatrics course or pediatrics course. We have one big course that combines every aspect of patient care that then builds on each other semester over semester. And so that's really going to play when we talk about the sort of style of the apprenticeship program that we do, because we are also one of the 12 bridge programs in the state of Illinois. So at the end of the first year, our students have an option to be awarded an LPN in addition to an RN degree at the end of their 2 years of academic service.
So the way we came up with this, so Lonnie said, is with this being an industry led, and I kind of alluded to earlier, we know that, as the healthcare industry continues to change over the years, the biggest thing we're seeing is the nursing shortage. There's a lot of things and factors that have come into play. These positions are getting harder and harder to fill. And then, of course, we all know that we went through COVID and that just exaggerated all the troubles that we were having with staffing. So some of the things that we're seeing being a rural community is, of course, the increase in numbers of patients. Patients are living longer with more chronic illnesses. We need more healthcare workers to take care of them. An article that was published in People Element showed that more Americans over the age of 65, there are more now than any other time in history, and this population is expected to grow by 75% by the year of 2030. So this is not going to change. This trend is moving and will continue. There's an increased demand of the patients because they're sicker. The increase in number of older patients has a direct correlation with the number of patients with those chronic diseases such as high blood pressure, CHF, chronic obstructive pulmonary disease, diabetes, and a whole lot of other things. There's an increase in numbers leaving the bedside and the nursing profession altogether. There are so many positions now that don't require you to be clinical or be at the bedside. They can work from home. They can work in different capacities, and nurses are liking that. They're getting to stay home and have that convenience. COVID burnout played a huge, huge role in staffing and trying to find nurses. These higher wages were being offered by travel contracts and huge sign-on bonuses. And then with us being a small rural community, we have a limit of nurses in the nursing pool that we can get. And we are also in competition with some bigger facilities that are close by. We're about an hour in every direction for a bigger facility who's able to offer those higher wages that being small and critical access, we just can't quite compete with. So this slide just kind of represents the expected growth of the Illinois residents over the age of 65 versus the nursing growth. So that red line shows the growth of those people over 65 who we know are going to have more chronic complications and require more care. But that blue line down there at the bottom pretty much stays steady. And actually, if you look really, really close, it's actually declining. It's not even going up. So the number is just not comparable for the patients versus the nurses that are going to be there to take care of them. So kind of what we had to do is we had to get creative. We had to develop a new talent pipeline strategy. We sat down. The idea of the nursing apprenticeship program was brought up in a meeting when we were talking about what we were going to do with the health occupations program here in Clay County. We sponsored that for the local high schools. There was some delay in that because who they had in teaching it and the way it was structured, they had decided to not have it. We are very thankful that our administration team said, no, we have to have this program. That is a feeder for CNAs for our facility and for nurses because the local colleges require them to have their CNA certification in order to go into the nursing program. So we did that. And as we were talking along, someone brought up, what about a nursing apprenticeship? And we kind of are all taken back because nobody really knew where to start. This was a new concept. But like I said, we needed that wave. We were growing our own because we're not pulling like we should from other places. And we just don't have that resource. So we were set up some communications between us, IECC, and then I reached out to Apprenticeship Illinois and got to work with Nate, who was very, very helpful with this process. And we started discussing just basically what this would look like, what could we expect, the different aspects. Again, I worked in healthcare, so apprenticeships were not in my background. So I had a lot of learning to do. And so then we partnered with IECC, got the apprenticeship approved after a bunch of paperwork through the Department of Labor, and we developed that first nursing apprenticeship program here in the state of Illinois.
So really for both of us, Clay County and then us at IECC, it was a win-win-win opportunity. It's very funny when I got the phone call from Cami, I just returned from an OADN conference where I sat through an apprenticeship presentation about the Indiana model, and they talked about all the perceived roadblocks and how they handled them. And so the moment I got the phone call, I was like, this is just the universe telling us to move forward. So there are a lot of benefits to the students here. They do get their tuition covered. They do receive stipends and payment for being in the classroom. And then they do also have a job at the same time that is very accommodating, obviously, to their school schedule, their study needs. This really has allowed our students to thrive. For the CCH employees, they get immersed in the culture, they understand what it means to work at the hospital. They have guaranteed employment upon completion. They're cross-training during this whole process. And then really, for our side at IECC, we also are able to use this as a recruitment opportunity to help us increase our enrollment, because part of getting into the apprenticeship program is that you have to already be accepted in our IECC nursing program.
So this slide just kind of represents a timeline of how things moved along. I will tell you there was a lot more things going on in the background than what these little boxes represent. Some of it was even kind of a blur, but we kind of moved through. So we developed that idea. And on our end, we had to get administrative support, which we are very fortunate that we had. We reached out to our local college, and we were very thankful that we have IECC, who has four here in the area. So that kind of gave us a broader area. And we set up that agreement, and we reached out to Apprenticeship Illinois. And like I said, we worked with Nate and got his help. We then moved on and kind of went through the competency and what we wanted. The nice thing about this apprenticeship, especially being the first one, was we got to set up and say, this is what our expectation is going to be. You know, they're not just going to be a med-surg nurse. We expect them to learn the skills and move on. And not only can they work in one department, but maybe they'll work in med-surg and they'll work in ER and they can work in surgery, or we can float them to the clinic. We want that versatile nurse. Not only does that benefit us, but it makes them a more well-rounded nurse, and they're going to have better and more successful skills. Once we got all that done, the paperwork done, and we sent that into the Department of Labor to get approval. Then we determined how to market the apprenticeship. We did lots of conversations. How are we going to get this out there? And we were very fortunate that we were able to get it out on our website, our Facebook. The college did the same. I was able to go and speak to the nursing students on their first day. They have a welcome day early on in May, and I was able to get in front of them all and explain to them the opportunity and what a wonderful opportunity it was and what the benefits would be. And then they were able to apply. We brought in, and it was very competitive both years. So we brought them in, we interviewed everybody. We picked the top two apprentices for each cohort. And then we just kind of moving on as we're still going through it. It's still new. The biggest thing is we're offering continued support for the apprentice and monitoring their progress. We work really closely. I work really closely with Carissa Miller at IECC, who does the apprenticeship stuff. It's very thankful. She enters the stuff on the Department of Labor website, but she's also checking in. So between the two of us, we're talking to them and we're making sure, what do you need? We want them to be successful. So if one of them is struggling, okay, we're going to sit down and maybe I need to meet with you or another nurse in a certain area so we can get you tutoring or whatever services that they might need. So how the program is structured, this is kind of the basic breakdown. It's very time management and time set. So the applicant must be accepted into the IECC nursing program. This says fall of 2023 because I stole this from some previous slides, but in the fall program. They must have an Illinois CNA certification. They must complete the application process and, of course, apply. Then we're going to pick those top two, as I mentioned before. The requirements of the apprentice, so we require them only to work one 12-hour shift per week. We don't want to overload them. We know nursing school is hard. The 12-hour shift and the stipends for the school are to help them financially, but that way they can really focus on school and succeed. We do require them to sustain our standards of performance and our expectations. They're required to manage or maintain a C average in college courses, and then they will complete the total apprenticeship program, which is 4 years. This is 2 years in school, 2 years out of school. For on our end, we agreed to pay the cost of the tuition, fees, books of the nursing program from the time they begin the apprenticeship program till they finish nursing school. We pay for hours in the nursing classroom. We do not pay for hours in clinicals, but just the time that they're in that classroom. We ensure that they obtain 144 hours of education annually. This satisfies their requirements for the first 2 years with school and that. And then in-house job training to satisfy the additional 2 years of requirement. And they'll work through that competency in those final 2 years, making sure that they are well-rounded. And this just ensures that they're able to move along the competency form. And we're going to be communicating, of course, with the Department of Labor and the college with Carissa just to make sure that they're staying supported as we move along. So for our approval processes, I will speak to the kind of the hospital side. So big things that we looked for, we of course had to have approval from the hospital administration side. We are a county-owned hospital. We're one of the very few of those left. And so we did receive support from our county board as well and the hospital board. So we made sure that they were good with this process. We completed all the paperwork with the help of the apprenticeship navigator. All the Department of Labor paperwork was completed and sent in for approval. And then, of course, we had the partnership agreements established with IECC.
And oh, sorry, do you mind going back? I'm going to do our section there at the bottom. Perfect. And then for the IECC sort of side of the approval process, we of course also had to have that agreement approved. And we have a board of trustees, and so they are the ones that ultimately did approve the agreement. In addition, we also had to have consideration and conversation with two sort of external stakeholders. So the first was the State Board of Nursing. We had to go to the State Board of Nursing and determine what and or if the notification process was for the State Board of Nursing, because we were entering into an industry-led apprenticeship where the unit of education was not modified. We did not have to acquire any Board of Nursing approval. And so that's a really big distinction when you determine the model you want to utilize for the apprenticeship. If you are utilizing an academic-based model, which then will alter your unit of education, you would need Board of Nursing approval. But since this is industry-led and an apprentice and a non-apprentice will receive the exact same education from IECC, we needed no State Board of Nursing approval. The other bit of consideration was with our accreditor. Because nursing apprenticeships are still new, when we initially established the nursing apprenticeship, the accreditor did not have a standard for apprenticeships. That standard came out approximately 8 months after the start of our program. Once it came out, we did have to clarify, and again, because we were an industry-led partnership that didn't alter the unit of education, we were not responsible for the competency forms, we were not responsible for the sort of the precept or the training process. We did not have to do anything other than just let them know there was an apprenticeship approved on our books. And then we are not required to do any sort of annual reporting on that apprenticeship unless we were, of course, to change the sort of models and process and then look at altering the unit of education. So how the apprenticeship timeline worked, so it kind of models our ladder program that we have here at IECC. So the students are starting the apprenticeship, and as part of our admission process into the IECC nursing program, students have to either have a CNA, or because we are a bordering state with Indiana, we do allow students to hold a out-of-state credential and or have that sort of like out-of-state patient tech job that we see pretty often in Evansville. But in order to qualify for the apprenticeship, they did have to have an Illinois CNA. Then they started to take the first year. As a ladder program, that allows those students after their first 2 semesters to take an optional summer exit where they can earn their LPN credential. As part of the apprenticeship program, they have to be able to level up their credentials. And so this fit in beautifully with that plan. And then at the end of the 2 years, they leave us with that RN credential.
Oh, I'm going to have you go back a slide for me and I'll finish that up. So, as Alani built on what the educational portion of that looked like. So, once they finish that, they graduate from the RN program, they pass their NCLEX, their license, they're going to stay with us for another 2 years. And during that 2 years, we will work through their competencies for the Department of Labor for the actual apprenticeship itself. And also, we contracted them to stay for the full 4 years, just to kind of give them a little stake in the game as well. And the nice part about this is they will finish this program with a Department of Labor Journeyman card, which is something that is very new for nursing. So it's going to look very nice on their resume, even though we hope they stay with us and the goal is to retain them. They're going to be a more well-rounded nurse. They're going to have a lot more experience. So first year, we finished up our first year. We're actually halfway through our second year. The way things are looking for us now, our first cohort completed their first year of nursing school. They've completed the LPN course and they're currently working as LPNs and they're doing an amazing job. The apprentices have great attitudes. They're exemplary employees. By investing in them, we have found they've become owners in our organization and they're investing back in us. They're changing that culture. They're exhibiting great positive attitudes. So I just wanted to share a couple quotes. We had National Apprenticeship Week here just a few weeks ago, and we exhibited each one of those and spotlighted them. And these are some quotes that they had given us. So one said, "The apprenticeship has been a game changer for me, helping to reduce the stress of balancing work and studying and allow me to focus on reaching my goal. Without this opportunity, the journey would have been far more challenging." And another one said, "This program has given me more resources than I could have ever imagined, not only to help me succeed in school, but also to become the best nurse I can."
And then from us as an academic partner, we are seeing that the apprentices are much more invested in their education. Obviously, they have, I guess the phrase is much more skin in the game, if you will. They are obviously very happy to have jobs. They are happy to have that payment made for school. And so I would say even more than the standard student, they really are devoted to exceeding educationally. And then we are able to see, because of that extra shift that they do, that extra exposure that they have, they perform very well in clinical and their skills, even above their peers, because they have more time in the hospital. They have more hands-on experience. They understand the atmosphere that they're walking into.
So year two for us, like I said, we were halfway through that year two. So as I mentioned before, that first cohort of two, they're in their second year of nursing school, working as LPNs. This has helped fill in some holes in the nursing openings that we've had because they've moved from that CNA role into that LPN role. Now they're able to take patients with the oversight of an RN, as in any other LPN would. Our second cohort they are in their first year of nursing school. They're both working as CNAs and they're filling those open positions as well, or openings in our schedule. This has improved our staffing by 2 part-time LPNs and 2 part-time CNAs. These apprentices are very reliable and accountable employees who show up for work and they do their very best and provide quality, compassionate care to our patients.
And then we're able to see on that academic side that the students really are becoming accountable. They're accountable to each other. They're accountable to the fellow apprentice. They really want to succeed and do well. And then they see each other all on the weekends pulling shifts and they're talking about school and they're really, really invested in their schooling process. And then we are starting to see some interest during the admission process, which was our hope, that we could use this to help increase admission, because it is a really good way for someone to be able to manage and financially pay for school, to help us become even more of a competitive process.
So our future plans, we're planning to continue with the RN apprenticeship program by bringing on 2 new apprentices every year while there's a need for nursing staff. And realistically, we know that that need is never going to go away. I would love to see a day that we walk into work and there is no openings in our job board and that every position is filled and nobody's leaving, but we know that people move and they grow and they move into other positions and there was always going to be a position opening. So year three will result in even more improved staffing. At that point, we will have two full-time RNs, two part-time LPNs, and two part-time CNAs. And year four of staffing will result in four full-time RNs, two part-time LPNs, and two part-time CNAs. And as long as we continue this program, that's where we're going to stay. So we are going to see those positions being filled and being maintained. And the idea is that, they'll choose to stay close to home as full-time employees. They won't want to go anywhere. They know how wonderful it is here at Clay County, and they'll see those benefits and will retain them.
And then we really do anticipate that the apprenticeship's going to continue to draw interest into the nursing program. Like anything else, when you start, it's about exposure. It's about talking to people. When you say apprentice, the mind automatically goes to like a journeyman, automatically goes to, you're thinking an electrical distribution system, something of that, as opposed to thinking about those healthcare opportunities. And then we do know that these students are performing above their peers as far as in clinical and in skill-based. And we know many studies have shown that when you have stronger students, they can really help in things such as our retention numbers, our pass rates. When the students are really devoted to their education, they can use that as a tool to even help their peers, leading study sessions, talking about tutoring, sharing their knowledge and their input. It's only going to continue to improve our student experience.
Some of the things that we've learned along the way, I have to say this has been a very, very smooth process, especially from starting from the ground and, to be honest, not really knowing what we're doing. Thank the Lord for Nate. He was so helpful on getting paperwork done. I really leaned on him significantly to get through that. Uh, Things we do, and I do recommend, is developing clear lines of communication between departments involved. So our program is set up as a med surg or medical surgical nursing program, but education oversees the program as well. So not only do I oversee them, but that med surg manager does too. So the med surg manager is involved in inputting their time and checking their payroll and making sure things like that are going okay, where I'm more kind of their helping hand and making sure that school side is going well and they're getting what they need. So we have to work really closely. And then just defining those internal roles of who's going to do those tasks, who's going to do payroll, who's going to do hour monitoring, who's going to do your check-ins and ensuring that's getting done. So you just want to ensure that you find that resource in your area that can help and bolster the program as well. The other advice I give you is just be a beacon of support for your apprentices and check in to see if they need anything or that anything's changed. We know that people's lives change as we go along, so they may need some additional study help. I had one come to me and she said, I am struggling. I need help. I know I need help. I've tried it this way. I've tried it this way. What can we do? And we sat down for 4 hours for 2 different days and she passed. And with that study help, she was able to take that from one semester to the next, and she did really well. So just accommodating whatever they need. We want them to succeed.
And then as far as academically, we are looking at how can we better market the program? How can we make it so a healthcare apprenticeship program is part of everyone's everyday conversation? So being strategic about that, working with our internal marketing team, figuring out even ourselves as instructors, as faculty members, what can we do to increase the knowledge about this great opportunity? And then not being afraid to take the leap. I feel like in academia, there is always a hesitancy to do something new. Everybody always wants to, go a little bit slow. I'm a bit of a messy cook. I say let's jump and let's ask questions later. But with a great support from Apprenticeship Illinois and having all these different individuals in, it really made the process seamless and it gave us a level of understanding and clarity. And it really made that leap not so scary. So I would say just don't be afraid. The leap is not scary at all. And there's great support to help you along the way.
So I have a couple of questions. And if you're watching and you have questions, feel free to unmute or drop those in the chat. But I wanted to start off just because I noted in both sort of halves of your presentation, a big point was securing that internal buy-in at your organization. And so we have folks on the call who may be from community colleges or may work with healthcare providers that similarly have to try and, convince their admins this is something worthwhile and exploring. What would you say was most important to your administrators in making the decision to move forward with this? And what are some lessons you might take to people who are trying to secure that buy-in internally? Obviously, we just heard it's really great to have it clearly delineated who's going to do what. What else can folks do to help move this along internally?
I can tell you on our end, one thing that we found was really helpful is the WIOA support that we received. They did help offset some of the costs that we were paying for tuition for our first cohort. Looking things, everybody gets scared when you start talking money. Nursing school's expensive. And so admin, that was their question is, how are we going to pay for this? Of course, they were very supportive and they said, we'll just pay for it. And if we get that WIOA support on the back end, great. But we approached it with that was one of the buy-in things that we took to them, as well as, okay, we're going to look for grants or whatever else we can do to help support the program. That was huge, especially for not only our admin, but county board. What's this going to cost us and what's this going to look like and what's going to be the benefit. But then when you tell them you have two nurses who will be here for 2 years guaranteed contract or they're paying it back, they were okay with that.
And even the money side for us mattered, which is interesting because we're not necessarily fronting money, but being able to explain how was that bill going to get paid for our business office professionals? Would this end up in a hold on a student's account or would this not? Those were the details that obviously, to be good stewards, it was expected that we kind of came up with that plan for. And then otherwise, it was very helpful that I had a grasp on the accreditor and the Board of Nursing requirements before then going to, at that time, our college council, our board of trustees. That way they understood basically what was the extra requirements that we would be entering in with this. So I would say, especially the academic side, knowing your accreditation requirements and then knowing how that business office process in that case could work did help to secure that in-house support.
Thank you both for great answers. And one thing I want to point out, and sometimes I like to do this, is just take over the webinar at the end. Is one thing I love about your program is that it shows that you don't need to have a cohort of 10, 12, 15 apprentices to make a huge difference in your organization. You can start with a cohort of 2, and even just maintaining that cohort size from year to year, as you said, the returns are increasing because not only do you have an additional 2 fully trained RNs, but you also have those CNAs, those LPNs, you have people in the process of that residency. And so it just shows that organizations, I think, sometimes feel that they can't dip their toe. They have to either go all or nothing. They have to say, this is where we're getting all of our nurses from. And wouldn't that be great? But obviously, logistically, that's not always going to be feasible. And so I love that just with that cohort of 2 nurses, you're seeing such dividends and culture improvements just from that investment. And so I think that's one of the takeaways I always love about this program is it's so scalable. This is a 20-bed rural hospital, and this model could be recreated anywhere. And that's so exciting. Do we have any other questions for our 2 expert presenters? Obviously, Jordan dropped their emails in the chat. I'm sure they are happy to field questions to their email as well. Anyone else with questions? If not, I'll hand it over to Jordan, and we'll all enjoy the rest of our lunch.
I actually, if no one else wants to come off mute, I have a question. From my previous role, we were looking at starting some healthcare apprenticeships, and I know that I wasn't directly in the conversations, but you talked about the clinical hours not being paid. Is that how you chose to do that, or is that an accreditation nursing board kind of limitation to this model?
So that is an Illinois law that we can't pay for clinical time. We do also, and I don't know that I specified this, we pay for time in the classroom. We do not pay for lab time. And that came down to this is a part-time, no benefit eligible for position for the first 2 years for us, which was part of how we sold this as well to admin. So we had to watch those hours very closely. I spent a lot of time calculating up where can we get the most hours for them without going over what they had to have or what they were allowed to have to be benefit eligible. But once they do finish the program, they do get benefits. They are a full-time, fully benefited employee.
And
And
then
that's a
for the
great,
student, oh yeah, no,
sorry.
and that totally makes sense. Are the students that are in the apprenticeship then, do you have them like sign a waiver that they're not working other part-time jobs, or is it just you're hoping that they don't because there's enough supports kind of in place for them? Because I know
So,
some students that I worked with would had to have a full 40-hour week paycheck to kind of make ends meet, regardless of what, the class demands were. So I'm just curious what you've seen on your end as this has gone on.
so that's a really good question. Honestly, we hit that right up front when they come in to interview. We tell them, you're only going to get this much. We don't require that they not work anywhere else. They don't sign any contract. If they want to moonlight elsewhere, I have one apprentice who actually works PRN at a local assisted living facility as well. When she's off out of school, things of that nature, because she is limited with us, the expectation we just explained to them is the expectation is that you are passing your classes and you are doing well. If you are seeing that you're struggling, then we need to sit down and have a chit chat about, what's causing you to struggle. Are you working nights at that other job because you have to have that income? And do we need to contact the college? Because I'm sure Alani can speak to this, but there are resources to help at the college as well that are available that maybe that person's not aware of. So no contract, we do let them, but we just make that very clear on what the expectation is.
Correct. We are very lucky that we have utilized some of our PATH grant funding, which, if any of you are in sort of healthcare education, the PATH grant. It's a state of Illinois grant that we've utilized that to allocate to two individuals who are just devoted to seeing our students succeed. So that is whether it's academic support, whether that's connecting them with local institutions for grants and scholarships, or figuring out how to get the hold off their account. They have helped me find housing for students with a mattress the same day. I mean, we have worked through numerous issues. And so we're so grateful that we are a district that sees the importance in supporting students in a well-rounded aspect. So that way, if that situation were to arise, we have somebody already here, already familiar with resources to directly send the students to champion them through that tough time.
And I think that really
Awesome.
speaks to the importance of partnering with a great community college district like IECC, where they have the resources to connect those students to those wraparound support services and additional grants and stipends and means of helping them be successful. And so it's through partnerships like the investment that IECC's made, the investment that Clay County's made, that these apprentices aren't going through it alone at all. They have whole teams of people holding them up and helping them move through these programs, which Kami and Dr. Frederick are both huge parts of. So thank you both again for your time today, and thank you for everybody for attending. We're so excited to see healthcare apprenticeships continue to grow and thrive in Illinois.
Yes, thank you. This is recorded. We'll post it online. I'll be sending out a link to the recording here shortly. There also will be a survey. If you could fill that out, that would be great. And again, thank you to Alani and Cami for joining us today.
Thank you so much for having us.
Thank you very much.